Very big decisions, along with the cost and potential change of lifestyle. A big concern can be finding a real treatment with someone reputable. Dr. Jean Loftus with Loftus Plastic Surgery Center is here to help us separate fact from fad. Good to see you, Dr. Loftus.
Thanks, Sheila.
I know this is a really busy time of year for plastic surgeons, isn't it? Because
Yes.
people want to get ready for bathing suits and things
Right.
like that.
Exactly.
So you say beware of every new procedure we might see in magazines or on TV. Why is that?
Well, I've got a few examples for you today, and I thought we'd focus on fat because it is swimming suit season,
On
and
fat?
everybody hates fat.
Okay. It seems like there are so many commercials that say they can take away our fat.
Yes, and let's separate them out right now.
Okay.
So one example is something called mesotherapy.
Mesotherapy, okay.
Mesotherapy is a procedure that involves injecting fat with enzymes that dissolves the fat. Great idea, and the fat goes away. Works very well in a lot of people, but in some people it causes lumps and bumps so bad that about 5 years ago the American Society of Plastic Surgeons banned plastic surgeons from performing this procedure.
Okay.
And in spite of that, some doctors still perform it. So that's one thing to be very concerned about.
Are there ways of removing fat without surgery?
Yes, and that's
Okay.
another great example. So everybody's heard about these procedures that involve heat or cold, and there are a lot of them out there. A lot of them work very well, but in some people they don't work at all.
Okay.
And in some people they can cause dents and divots, which when they happen are really hard to fix, and sometimes you can't fix them, and that's particularly true in people who have loose skin. And they're very expensive. By the time you've paid for multiple of these non-surgical treatments, you probably could have had liposuction, which undeniably is more effective and more predictable.
Okay. Is there a way of knowing if you are one of the people that it will work on?
Really good question. Generally, if you've got focal fat and the skin is not loose, you're going to probably get a pretty good result.
Okay. And then there's something else called the Brazilian butt lift. I have not
Yes.
heard about this.
Oh my gosh, you don't watch the Kardashians, evidently.
No, I don't. Do they talk about that?
I
Okay.
don't know if they talk about it, but they've made it popular.
Okay.
And yeah, I hear about these things in the operating room, actually.
Right.
So what that is that's taking fat out of a part of your body you don't like it and putting it into the buttocks. It makes the buttocks fuller and rounder. It gives the illusion of a lift, but doesn't really involve a lift. Great idea. Works very well in some people.
Okay.
But, always a but, it can cause areas where the fat collects and turns hard.
Oh, no.
Becomes painful.
Yeah.
That does not look good either, to have these lumps and bumps. But more seriously, this Brazilian butt lift is the procedure in plastic surgery that has the highest death rate.
Oh, no. Okay.
Very seriously, it can cause infection. It can cause death through introducing fat into the bloodstream. It can cause death through a few other mechanisms, and the overall death rate with this procedure is 1%.
Wow.
And until this gets sorted out and optimized by plastic surgeons, I cannot recommend this procedure.
Okay. So if something is new, if it's the hot new thing,
Yeah.
should we get it right away or should we wait a while?
You should wait.
And why is that?
Well, so many things have come and gone. Plastic surgery is historically, I would say every year something new comes out, and if it has lasted for 5 years, it has survived the test of time. If it has not lasted 5 years, I would stay away from it.
Okay. Dr. Jean Loftus, thank you so much. Dr. Loftus also has a book. It's called The Smart Woman's Guide to Plastic Surgery. More resources in there. Appreciate your time.
Thank you.